All right, thanks, Jordan. All right, afternoon, guys. Thanks for taking time to hop on our every other week update call. Like usual, we'll go ahead and start with a review of the data. So, Jordan, if you want to go ahead and start.
Okay, sounds good. I'll share my screen here, so you might be able to see what I'm talking about. And so here we have the MySafeStart County data. We're looking at a different color purple this week, which is a good thing because that means our counties are moving out of the E risk level. And as you can see, most of them are in the C risk level besides Newaygo, who is trying to catch up, but at least they're in the D level there. Our daily cases per million overall is at 60.2, which is a large decline after the last report, and this 115 number and the 7.3 number both come from last week. So I know we haven't spoken in a couple weeks, but those numbers do come from last week. My computer keeps switching up. Are you still seeing the purple?
Yep.
Okay. So you can also see that our positivity has decreased at 5.6%, and we've seen a decline in cases with a 46% decrease when we compare this week to our week previous. The cases that we have seen this past week are household and community contact, school, daycare, inpatient and pre-appointment testing, care facilities and healthcare workers, recent travel, social gathering, and worksite exposures. Our total number of jurisdiction-wide cases as of yesterday was 19,585, and our cases by county as of yesterday are Crawford with 919, Kalkaska 1,043, Lake 587, Manistee 1,111, Mason 1,998, Mecosta 3,014, with Ferris reporting 739 cases, Masaki 1,255, Newaygo 4,516, Oceana 2,613, and Wexford 2,539. In the past week, there were 5 deaths reported and 649 people recovered. Yesterday, there were 2 positive inpatient cases at Munson Healthcare Cadillac, 0 at Munson Grayling, 0 at Munson Manistee, 4 at Spectrum Health Big Rapids, 5 at Spectrum Health Gerber Memorial, and 2 at Spectrum Health Ludington. So our hospitalizations are also remaining fairly low. And now we can switch to our vaccine table here. So let me know if it doesn't switch for whatever reason. But as of yesterday, the state of Michigan had 59.1% of the population that has initiated their vaccine series, and our next step in that My Vac to Normal plan is at 60%. So we're almost there. This past week, DHD-10 administered over our 100,000 dose. So we've administered 100,333 doses as of this past Monday. And 3 of our counties are above that 55% mark now, with Lake, Manistee, and Mason having above 55% of their populations that have initiated their vaccine series. We remain pretty stable at the percentage of breakthrough cases that we've seen, so this will always be a few weeks behind just how we get the data, but it's been remaining steady at that 0.18%. And then we have the tabs with the initiation by age group and county. So Mecosta and Newaygo remain to be our lowest ones still. And we also have the completed tab here for you. So next week, well, we don't talk for another 2 weeks, so probably the next time we talk, we'll see some percentages in this 12 to 15-year-old age group there. Anybody have any questions?
All right, thanks, Jordan. All right, so as you can see from the data that Jordan is sharing, we're seeing some good signs. Positivity test positivity is going down. Cases per million continue to go down. Daily cases go down. I think yesterday at 3 o'clock, we did report out 15 new cases in our jurisdiction. So it's been a while since we've been down in that area. So that is a good thing. Even have some counties that have 0 new cases. So again, that is good, and hoping to kind of stay on that track as we continue to move forward. As of June 1st, obviously capacity limits for bars, restaurants, and some other locations did increase to 50%. And then the the curfew on bars and restaurants was lifted also. So that allowed them a little more flexibility. And then as of July 1, as of right now, it's expected that all of the mitigation strategies are going to be lifted at that point with masking and so on. Now, one exception to that will be the MIOSHA workplace rules. We were on a webinar with the MIOSHA folks, and they made it clear that their workplace rules are going to be separate from the epidemic orders. And so we still may, the work sites will still have some requirements that they will have to follow. But for the most part, those individuals that are fully, with the exception of healthcare type settings or jails or prisons or other types of homeless shelters or congregate type facilities, if individuals are fully vaccinated, they will not have to wear masks. The individuals that are not fully vaccinated, they will need to remain masked. So for the health department, obviously, we did modify our strategy a little bit. We are considered a healthcare type setting. And so as of July 1, we are continuing with our required employee symptom checker, and that's the other thing that will continue. So it's all staff are expected to complete that when they come in the morning. And then anytime staff are in our clinical areas or interacting with clients, then it is expected that, it's required that staff will wear masks. Aside from that, staff that are fully vaccinated do not have to wear masks more in our common areas. Individuals who are not fully vaccinated are still expected to wear masks in that area. And so, we are continuing to follow that guidance, and even after the 1st of July, we'll continue to follow that, unless MIOSHA and or CDC changes that guidance. So that is how we are moving forward with all of this. I know in talking with some of our staff, they are indicated it's kind of a weird feeling not having masks on or coming into the building and not having a mask on at times. So just like it was when we started this a little over a year ago, it was weird having to put a mask on. Now just kind of the opposite. So hopefully our numbers are going to stay where they're at, and we are going to continue to see some good things. We do continue to do vaccinations, our vaccination clinics. We have scheduled in-house clinics that we will be doing through the month of June on Tuesdays and Fridays. Tuesdays are our late clinics where we have appointments till 6:20. And then we also are still scheduling some pop-up type clinics out in the community. And so to give you an idea, for this week, we had a number of clinics yesterday. We had one at Pentwater Public Schools. We had another one at the Bread of Life Food Pantry in Baldwin. We had one at the Grayling Middle School Gymnasium. And then we also had one out at Caberfait for their employees. And then also at Kirtland Terrace. So those are the ones that we had yesterday. Today, we do have a clinic here in Cadillac at the United Methodist Church. And then we'll have additional ones that we'll be setting up for next week. And so I think on the 9th, we'll be at the Cartus Food Pantry in Custer. Monday we'll have a pop-up clinic at Back to the Bricks here in the Cadillac area. And then on Wednesday the 9th, Harborview Apartments here in Cadillac will have a clinic at. So we do continue to look at trying to create opportunities to provide vaccinations to individuals where they're at, hoping to make it accessible, convenient for individuals to get vaccinated. Really trying to focus in on Newaygo County and Mecosta County, are two counties with the lowest percentage of vaccination rates. And so I'm going to be reaching out to some of our partners in those communities after this meeting and look at trying to set up a meeting so we can have some conversation and discussion about if it is possible for us to look at some other avenues to get people vaccinated. We did just close out our vaccine hesitancy survey that we had out there. And so we're in the process now of compiling that data. And so once that is done, I'll share that with this group. I think it'll be some interesting data for you to review. I'm not sure the total number of respondents that we had gotten. I know after the first week we had about 200, so not a lot, but a fair number that hopefully will give us an idea of what is going on out there. The other thing that we are seeing now, and you are probably seeing, and this is more along the lines of testing, is going to be the appearance of the home testing kits that are out there. So individuals can purchase these over the counter at various locations and then do the testing on their own. If you read the package inserts with those, it does say take your result and share it with your healthcare provider. And then your healthcare provider is in turn supposed to take that information and share it with the health department. There is some question as to whether or not that's going to happen. And so I know a lot of discussion at the statewide level as to how we want to handle that so that those results are getting reported in. And also some questions on will individuals actually share the results of those tests. So waiting to see, what's going to come about with that. But that is one of the things that we are, that we're taking a look at and kind of keeping an eye on. So other than that, I think that is the information that I wanted to share with you today, and just again, just to kind of highlight the fact that we are seeing some good things in our case numbers, in our positivity rates, and the data in general. Vaccination numbers, as Jordan said, we did exceed 100,000 doses in our jurisdiction, and that's what we as a health department have done. So with all of our other partners, I think it's in excess of 200,000 jurisdiction-wise. So looking at trying to add to that as we move forward with the goal of hopefully getting our jurisdiction to that, the counties in our jurisdiction to that 70% mark, which is that minimum for achieving herd immunity. So other than that, I'll kind of open it up for questions that individuals may have.
There is one in the chat box from Stephanie. She says long-term care is still wearing eye protection for protection against SARS-CoV-2. This is guidance from the CDC when the facility is located in areas with moderate to substantial community spread. I'm not seeing any updates to remove the eyewear, only masks. Originally, it was said eyewear was not necessary when no to minimal community transmission was seen in the community. What level would this be at? Manistee County Medical Care Facility would love to discontinue the eye protection if possible.
Yeah, that's a good question, because I also have not seen anything on the eye protection. So let me do a little more digging on that and come back with an answer. I can get you an answer and share that with the rest of the group too.
All right, and a question from Jeffrey. Is there any place to be tested for antibodies?
I'm not aware, Jeff, if there's any place out there that's currently doing antibodies. At this point, I don't know if any of the hospitals are. I think I saw Kevin on. Kevin, are you aware of any of the hospitals doing testing for that?
I'm not. I can check into that, but off the top of my head, I'm not aware of that.
Okay. So there's two things for me to kind of look into and check and see. Any other questions that you might have? No. Again, if not, that I think is the information that we had to.
We do have an update from Craig. He said if you donate blood to the Red Cross, they test for antibodies automatically.
Okay. Well, you'd have to donate. Anything else from anyone?
One more comment from the chat from Mark. Quest Labs provides antibody testing or obtain from your primary care physician.
Okay, so if you go through your physician, obviously you need to have an order for it. So, but I will also look to see if there's any other. I'll also see if some of the other neighborhood testing sites that are still in operation are doing any antibody testing also. So. Anything else? All right, guys, like I said, I think that's the information that we're sharing. Data, the data that we have right now is showing that we're kind of in a good place and hopefully along a good track here. Hopefully when we get together in 2 weeks, we'll still continue to be in that same trajectory. And if we have to get back together before that or we have anything else to share urgent, we'll send that out to the group. Otherwise, thank you for hopping on the call today, and we will get back together in 2 weeks. Thanks, guys.